Well, my name is Virginia Nave, and I was caregiver to my mother for 8 years during her Alzheimer's disease. And when she had MCI in the very beginning, it was pretty difficult for us to tell when she should stop driving. We didn't know, we weren't getting help on the issue. And then one day her best friend called me and she said, I was with your mom yesterday and she was driving. And she said, I saw my life flash in front of my eyes. And I said, oh, okay. So that started the ball rolling, thinking about it. So we decided to all gather for a barbecue at my house, and we would sit Mom down and have a nice, honest conversation with her. So we did. And we said, Mom, we love you, but Daddy worked a very long time so that you would have the means to have a comfortable life if he were to go before you. And that's what he did, but one car accident and that nest egg could be gone. It could be gone, Mom. And there was this look in her eyes like, oh, I get it. She said, you're right, I should stop driving. So we looked at each other and we went, that was easy. We were good. It was one of these. So we had our barbecue and had a great time. Then later that evening, I said, Mom, I need to get your car keys. And she said, why? And I said, because I'm going to take your car keys so that you can't drive any longer. And she said, why on earth would you think I wouldn't drive? So we thought, oh, okay, back to square one. We were back to square one.
I'd like to introduce our first speaker, Dr. Brian Ott, the director of the Alzheimer's Disease and Memory Disorders Center. I'm a professor of neurology at the Warren Alpert Medical School of Brown University. Brian did his medical training at Jefferson Medical College in Philadelphia and completed his internship and residency at the Roger Williams General Hospital Brown, as well as residency at Harvard and the Brigham and Women's in Beth Israel. And Brian has truly led the field in the study of driving safety and the implications of driving and dementia. Dr. Ott.
Thanks, Josh, and thanks for inviting me to talk to you today about the topic of driving under the influence of dementia. These are my financial disclosures. To start off, I'll just raise the question, older drivers, why should we be concerned? Older drivers in general are safe drivers. They don't get into very many accidents at all. They drive fewer miles per year than other age groups. And less exposure means they have fewer crashes. Older adults limit their driving exposure often voluntarily by avoiding heavy traffic situations, bad weather, and driving only during the daytime. And yet, from time to time, we hear these horrific reports from the media about crashes involving older drivers. And I'll show you one example here.
A fiery scene at a gas station in Massachusetts. Instead of hitting the brakes, an 83-year-old man stepped on the gas pedal. He ran into an attendant and a gas pump, causing a fire. The worker is expected to recover. The driver wasn't hurt, but he says he may give up his license.
Let's hope so. Here's another one of a 92-year-old man in Wisconsin. We don't have audio here, but we see the person crashes into 1, 2, 3 cars, backs up into another. Hits one on the way and rounds the bend. What's going to happen here? You guessed it. So these types of reports certainly raise the consciousness and awareness of the public about the potential hazards of older impaired drivers on the road. But as I mentioned, if you look at the top graph, the number of crashes goes down as we get older, And so they don't represent a major public hazard in general. But if you look at an adjustment for crashes that older people are involved in per mile driven, you see a different story. You see this U-shaped curve where with advancing age, past the age of 50, you see an increasing frequency of crashes per mile in older age groups. And these trends are even higher if you look at fatal crashes per mile driven among older drivers. And in this situation, older drivers appear to be even more hazardous than our highest risk group, teenage drivers. Although, as you see, the trends are going down in terms of the absolute numbers over the years. So there is a problem. Aging brings with it a number of changes that can affect driving and reduce safety, including changes in vision and physical function. And these are problems that are generally picked up by physicians in their offices and motor vehicle registries and addressed. But a more insidious problem is changes in cognition, and that's what I'm going to focus on for the rest of my talk. Normal cognition is important for safe driving. As it turns out, memory isn't particularly important for safe driving, although you need memory in order to find your destination. More important in terms of cognitive domains that can impact safe driving are problems and changes in visual attention and perception, including limited field of view. And the other domain that's particularly important are changes in executive functioning, leading to impaired judgment and decision-making and increasing traffic risks. And these are two domains that physicians typically do not check for in their office examinations, and so these may be missed. This graph depicts two research studies done independently by our group on the left and the people at WashU on the right, where we mapped the natural history of driving decline in people with cognitive impairment over the course of 3 years and found remarkably similar results. People with a mild cognitive impairment shown on the bottom curve, on average, are able to continue driving and pass a road test for about 1 year. On the next upper curve, people with mild cognitive impairment or CDR 0.5, questionable or very mild dementia, on the other hand, on average, were able to continue driving safely for about 2 years. And so this gives us an idea of the range of time we have to work with patients in terms of getting them off the road. The other interesting thing about these studies is that we both found that the normal controls, the elderly people, normal cognition, also decline progressively in their driving abilities, as shown on the top curve on your right. And so we asked the question, well, why is this? These people, their cognition is okay, they're normal. Why should they be getting bad in their driving abilities? And one possible explanation is that these so-called normal elders have what used to be called incipient Alzheimer's disease, what we refer to as preclinical Alzheimer's. There have been a number of autopsy studies done on elder drivers who were involved in fatal car crashes, showing that roughly 50% of people have evidence of significant neuritic plaque pathology consistent with undiagnosed Alzheimer's, or at least Alzheimer's pathology. In one study where they looked at a control group of people who died of other causes, it was shown that the frequency of this kind of pathology was half of what it was for the people who had been involved in crashes. So in recent times, we now have the ability to identify people with preclinical Alzheimer's disease, people with pathology but no symptoms or diagnosis before death, and we're doing studies now of this group of people, what we call preclinical Alzheimer's, defined as people who have evidence of plaques and tangles, Alzheimer's changes in their brain, but don't have the symptoms of Alzheimer's or dementia. And using these biomarkers, whether they be spinal fluid tests or brain imaging with PET scans, roughly 30% of people over the age of 65 appear to have preclinical Alzheimer's changes. And this is also seen in previous postmortem studies, this frequency. So during the current year, our group, in collaboration with the people at WashU, have reported several studies on people with preclinical Alzheimer's and whether they're at risk as drivers. And the answer is probably yes. we did a survey study of 104 older drivers with and without dementia and inquired about whether who had undergone amyloid PET scans and asked them whether they had been involved in crashes or violations in the past 3 years. And we found that indeed there was a significant relationship between that history of being in crashes or violations and the accumulation of amyloid on PET scans. In the WashU prospective longitudinal study, where people are studied every 6 months over 3 years with road tests, they showed that people with evidence of preclinical Alzheimer's disease made significantly more errors in their road test driving. And furthermore, in follow-up over 2 to 4 years, those people with the spinal fluid biomarkers of Alzheimer's disease were significantly more likely to go on to a marginal or failure rating on road tests. So taken together, this data suggests that the hazards of driving in older people for those with Alzheimer's disease is really just the tip of the iceberg. That people with mild cognitive impairment also have risk, and even people who have pathology but no symptoms are probably at risk in terms of their driving abilities. And so this figure depicts a model of what we think is going on. If you look at the preclinical end of the spectrum of Alzheimer's, there aren't many crashes. People at this stage are still fairly good in their abilities and their cognition, even though they drive a lot. And at the other end of the spectrum, the people with established Alzheimer's dementia are not driving at all or driving little, and so they're not getting into many crashes, although they have a heavy burden of pathology. Maybe the people we really need to pay the most attention to are those in the intervening stage of mild cognitive impairment, as suggested by the woman who was interviewed in the video, because these people continue to drive. They're limiting their drive, but not very much, and yet they're accumulating pathology, and they do have cognitive deficits. Furthermore, this group of MCI are the group that are potentially a good target for remediation or training programs and other efforts to intervene and try to improve their safety on the road. So moving from discussion about the preclinical stage to MCI, what about people who have diagnosed Alzheimer's dementia? How much of a problem is that? The answer is it's big. Compared to other disorders associated with increased crash risk, dementia ranks right up there with the top group, alcohol and substance abusers, schizophrenics, and people with sleep apnea, as far as the risk of getting into a crash. And their risk is about twice that seen in people with episodic disorders of loss of consciousness, such as people with epilepsy and people with cardiovascular disorders. The errors that people with Alzheimer's disease commonly make include, obviously, forgetting where they're driving, difficulty navigating, failure to anticipate traffic situations, reduced problem solving around complex or stressful driving situations. Probably the most common thing we see is problems with maintaining proper lanes or choosing proper lanes, and failure to check blind spots. People with Alzheimer's disease drive like it's full speed straight ahead, and they don't pay attention to what's going on the outer fields of their view, such as you would think of at intersections, which is a problem. Does this mean that everyone with Alzheimer's disease shouldn't drive? Most researchers and the Alzheimer's Association itself believes that's not the case, that the diagnosis of Alzheimer's disease is not in and of its own sufficient reason to withdraw driving privileges. But the determining factor in withdrawing driving privileges should be the individual's driving ability. So if we accept that as the case, then where do we turn for guidance in trying to decide when should people be told to hang up their keys? We can look to the state, but there are differences in the country between different states in terms of policies about evaluating and taking people off the road among the aging population. In my own state of Rhode Island, there's no mandatory reporting for physicians, but if you do choose to report a person with Alzheimer's or dementia, you're immune from prosecution for doing so. Here in California, it's a much different situation. Here, there is mandatory reporting. The physician has to report the person with dementia to their health department, and they forward that report to the Department of Motor Vehicles, and if they don't, then they're potentially legally liable if that person goes on and gets involved in a motor vehicle accident. It's not only physicians who can report people with dementia, but also family members, police officers, daycare workers, neighbors. They can report using this particular form. And a report from others or the physician would lead to a request from the patient's physician for medical information shown here. And part of this involves the physician making a determination of whether the person has mild, moderate, or severe dementia. The patient signs a release for the physician to provide this information. If they've been reported and they refuse to allow the physician to report, then that in itself is grounds for dismissal of the person's license. At least this is as much as I understand about the process, not being here in California, but people could correct me if I'm wrong anywhere along the process here. But if a person is determined to have moderate or severe dementia, then their license is revoked. If they have lesser degree of dementia, if it's a mild or very mild, then they are brought in and they do a knowledge test. If they can pass that, then they'll have a vision test and also be scheduled for a formal driving assessment. If they pass that, then they'll be reassessed depending on the determination of the individual officer in 6 or 12 months. So how effective is this approach of mandating that physicians report people with dementia? I've not been able to find a whole lot out there in the literature, but I did find these two reports. In an article published in 2007, there was a survey done of California ER physicians who had seen people who had been brought in because of a question of an episode of loss of consciousness. And among this group, 83% responded they would never report a person with dementia to the state. This raised important questions about physician compliance, as far as I can tell. One retrospective study looked at a large number of older drivers involved in crash-related hospitalizations, and they compared the frequency of these hospitalizations in states who had mandatory reporting, and there are a few others besides California, compared to states that did not have mandatory reporting, and they found that there was no difference in the frequency of hospitalizations for crashes in older people. And their conclusion was that mandates do not yield significant older driver safety benefits, possibly to the detriment of older drivers' well-being and independence. So let's talk about driving cessation. This is the thorny problem that was presented in the opening video. What do you do to get someone to stop driving? The first thing is discuss the risk. The person needs to know why they're being recommended to stop driving, but at the same time, you can't just tell the person you've got to stop driving for your own safety and that of the public, because there's a loss of autonomy that's very distressing, and typically that will lead to either depression, anger, or a combination of the two. And so it's important when having the discussion to acknowledge that one has to get support from the family in terms of providing alternative means of transportation. They can be very helpful for this, but also the family can help to reduce the actual need to go out and drive by providing that things be delivered to the home, visits be made from hairdressers, people can visit so that they don't have to go out to visit. And it's important that these people, even though they're not driving, still get out of the house and engage in social activities, community activities such as going to church. So that being said, as was exemplified in the video, sometimes you tell the person they can't drive and they say fine, but then they go on and do it anyway. So just making a determination is only half of the story. What do you do if the person refuses to stop driving? There are a number of things you could consider. You could disable the car, take off the distributor cap, file down the keys. I think that's rather mean, actually. I think it'd be rather frustrating to the person to have to keep trying to start their car with a key that doesn't work. I think one ploy that I've used is to have the car taken away for repairs. and it never comes back. And you tell the person, well, how long it takes to get repairs done. They can buy that. And it takes advantage of the person's time disorientation. And eventually they get used to the idea that, oh, well, the car's out, it's just a junker, and I can do without it. But if they don't stop driving, then what do? Should you report this to the Department of Motor Vehicles? Physicians have issues with reporting people to the DMV because they feel it violates the doctor-patient relationship. But yet the AMA Code of Ethics has taken the position that if the physician is truly concerned about the safety of the patient and the public, that it is reasonable and, in fact, desirable for that physician to make a report about that individual. Okay, so what if the person's had an evaluation and they're not told to stop driving, but they need to be monitored? How do we monitor the older driver with dementia? To go back to our 2 longitudinal studies, we found that 69% of people with mild dementia were able to pass a road test. So even though you send them a road test, you should expect they're probably going to pass. There's a good chance. And it's also something you tell these people so they're willing to actually take the road test. If they do pass, then we recommend that they be re-examined every 6 months for their driving competence, however, with the general idea that they're probably going to be able to drive for not much more than a year, but it gives you a window then to get them to taper off their driving. And if you have the person reduce their driving gradually, that's generally better, meets with better success and acceptance than abrupt termination of driving privileges. The caregivers, it's important they get educated on the topic. There's some very useful material from the Hartford online that I would recommend. And begin the conversation early and repeat it periodically. As shown in the video, I think the right time to start the conversation is at the stage of mild cognitive impairment rather than waiting till the person has full-blown dementia. And the family should make opportunities to observe driving. Sometimes the person won't allow a road test, but they will allow the family member to serve essentially as the instructor and observer. And also it's important the family discuss any of their own observations about the person's driving with the healthcare provider during office visits. And in cases where there are concerns, sometimes it's good that the family support driving evaluations. And then it's an instructor being the bad guy or the DMV, or not the family member or even the doctor if they're told to stop driving. The physician, in the meantime, can work to maximize functioning in other domains important for safe driving, such as physical function, make sure the person's not on sedating medications. For people with MCI, I think not so much people with dementia, but one could recommend driving courses and cognitive training. And again, referrals to driving rehabilitation specialists may be in order if available in your community. So a road test, how good is that? It's administered by a professional. It could be a driving rehab specialist like an occupational therapist, could be a driving school instructor or a representative of the DMV. And it's generally thought to be the gold standard, since that's how we get our license, is by passing a road test. So that should be the determinant in terms of losing your license as well, inability to pass a road test. But we don't know if that's a good test in this situation. As I mentioned, most people with dementia will pass a road test. You also don't know whether failure predicts whether you're going to get into a crash or not. So we don't tell people, well, you failed the road test, let's go see if you're going to get into a crash now. We don't know how predictive the road test really is. We don't know how people will react in stress situations, and the thing you hear from the drivers themselves is it's not fair. I'm with a person I don't know, I'm stressed, I may be in a car that's not my own car, and it's just not fair. And so given these limitations in road tests, we've moved our research now to naturalistic data collection, where we're now observing people in their own vehicles, in their own environments, and what's going on. And what we see is that, and so we have, in the first study, we did road testing every 6 months, and we examined people for 2 weeks, or 2 to 4 weeks in their own car with continuous video, and rated their home driving, and found that in general there's a close correlation between road tests and home driving, but not for everybody. If you look at the group on the top, there's some people who do particularly bad in the situation of the road test. And these are people who have test-taking anxiety. So we raised the question, well, what really predicts getting involved in a crash, road test or home driving? And as it turns out, if you look retrospectively at history of being in a crash, the road test didn't do too bad. There was a significant relationship between road test performance and history of being in a crash, where we did not see that when evaluating how people drove in their home. So in summary, Alzheimer's disease affects skills necessary for driving even at the earliest stages of the disease, but many can still continue to drive safely for some period of time. Road test performance is a reasonable proxy for estimating fitness to drive for older individuals, but there's still no gold standard, so we do need to rely on monitoring by healthcare practitioners and the family, but do plan for gradual cessation and alternative means. So I'm just going to close in the last 5 minutes to talk to you about where we're at in our own research. We're now looking at a video feedback intervention that could potentially improve the safety of older drivers with cognitive impairment. What we're using is a device called DriveCam, shown here. It's a video event recorder mounted under the rearview mirror that shows a forward and backward view, and it's triggered by G-forces. So anytime you hit the brakes or swerve or do something of that nature, you'll take a video clip for the previous 4 seconds and then 8 seconds going forward. And that's transmitted then to a central station and to our research group for analysis. And the events are rated according to risk categories. And under these risk categories, there are specific errors that are rated for demerit points. And these demerit points are categorized as being moderate risk or extreme risk. In the pilot, we did a baseline observation period, 3 months, and then an intervention where people got to see their videos for about 3 months and got instructions and phone calls weekly, and then follow up with another 3-month period of monitoring only. And I'll show you in this video what the data looks like that we've been collecting using this particular device. So this is a person with a low-risk event who has mild dementia. Out of inclement weather conditions, driving down the road, comes to an abrupt break because there is a wire across the road, an electrical line. This is clearly an unsafe event and a near collision in somebody with mild cognitive impairment.
Autism and everything out, but when it comes down, push comes to shove, you know.
Yeah, but like all these people get like mixed up with it.
Didn't even see him.
This is a rolling stop. A lot of people do this. Somebody with significant dementia, Mini-Mental 16. So she rolls the stop sign. Again, we see this a lot, but she does it right in front of a semi coming down. This is a high-risk event in somebody with very mild dementia. He's in the left-hand turn lane. Gets into the right-hand lane. The light turns red. Yeah, she drives through it and makes the left-hand turn nonetheless. This is a near collision from actually running a stop sign, not a roll. So she's saying, sorry. This is a collision. Fortunately, we don't see many of these.
And like them on Facebook for a chance to
Woman
win
looks to the
grand
left,
prizes.
looks to the
So
right. She has
returning
mild
down
cognitive
705,
impairment,
Majestic Morgan,
but she doesn't look
downtown
straight ahead. Barrier.
You didn't see that.
Chicken cabinets for Tuckett.
Didn't see that. But we also see good things. These drivers do drive well sometimes. It's not all bad. So we'll show you some positive events as well. Because sometimes they get into crashes because of the bad driving of other drivers. Someone pulls out right in front, and she stops and lets the car go. This is the woman who drove over the concrete barrier.
You heard it. Be one of the first to try better than
She
ever
actually sees
proactive solutions.
someone
You'll
walking
receive a
into the
60-day
breakdown lane
risk-free
wearing
trial plus.
black clothing. This is somebody who stops to let a jaywalker wearing a safety vest go by. This person with mild dementia probably anticipates a car pulling out in front of them. They kind of take the turn too widely. So these are the results of the pilot study, and what we found was that during the intervention phase, where people were getting information, seeing these videos every week and getting calls and discussing them, and that the frequency of these unsafe driving events dropped by about 45%, which is good. But interestingly, during the third phase, where again they were just monitoring only and not getting any feedback, there was a further reduction in the frequency of these events, and they were down by as much as 60% compared to the baseline. So the question is, why did that happen? And I don't know, but I think what occurs in this situation is once you start training the family member, the caregiver, to be attentive to the problem, they see what they are, and they become good traffic coaches. And that carries through after this 3-month period of getting this kind of feedback every week. So in summary, in-car video monitoring and feedback at least shows some promise for helping drivers with mild cognitive impairment and Alzheimer's disease. It has 2 advantages. First of all, it's a way of monitoring the driver. And when you have these videos and it's clear that they need to stop driving, you can actually go over the video with the person so they can understand what the situation is. But if they're continuing to drive and they're okay, it also can improve their actual driving safety as far as we see in these small number of patients we've examined so far. So currently we have a clinical trial that's looking at monitoring only versus monitoring with provision of feedback that's funded by the Alzheimer's Association. This is a 3-year study of 60 drivers with MCI or mild Alzheimer's that we're following over a year, and we're about halfway through that study right now, and hopefully we'll have some positive results to report to you in the next year or so. So on that positive note, I'd like to thank you for your attention and have safe driving.
There are growing microphones and, of course, cards in your folder. I see a hand.
Are you picking?
Dr. Ott, my mother believes that self-driving cars would solve this problem. Have you done studies or plan to do studies in self-driving vehicles with patients with MCI or preclinical dementia?
Yeah, it's a good question. Certainly the industry, certain people in the industry such as Google believe that is the answer. And I was at a conference in Massachusetts involving industry as well as other researchers, and they think once we get self-driving cars that people won't have to be exposed to the risk. But I think it's somewhat far off, and I don't think that's going to be an answer in many communities. But certainly certain urban communities may get those kinds of designs. They'll make that possible.
Good morning, Doctor. My name is Steve Venanzi, and as I'm listening to your demonstration this morning, I'm thinking about the principle of intermittent reinforcement and how we're all encouraged by sometimes having good behavior to rationalize our bad behavior, especially on the road. And I'm wondering if your research has sort of investigated that process with Alzheimer's people, at one level saying, they can be successful one day and the next day they're not.
Yeah, there certainly is a denial component, at least, that people think they're good drivers and they've always been good drivers. And if you see something negative on videos like that, they say, well, that's not the way I usually drive. And And what we're finding is that people who have that attitude that won't actually admit that there's a problem they need to address and adjust their driving tend not to respond to this type of feedback training. So it's not for everybody. It's not likely to be successful for everyone.
Dr. Ott, I'm interested in how you approach people to convince them it's a good idea to stop driving. And I think you said early on it's not productive or not wise to tell them that they should stop for their own safety or the safety of others, because it may tend to make them depressed or agitated. And so I want to make sure I understood it right. And then I'm just curious of what you suggest when you're trying to approach somebody to help them realize that it's time for them to give it up.
Yeah, I wasn't mean to say that you shouldn't tell people they have unsafe driving behaviors. They should know that. But I explained to people what Alzheimer's is and how it affects vision and attention, and so they understand why they're at risk, and people generally will accept that. Whether they'll apply that to themselves or not is the challenge. And you know, if you've had actual events where they bumped into other cars and so forth, you can talk about those issues. If you have videos like I showed, that helps a lot. If you have observations from family members to discuss as discrete talking points that they've demonstrated unsafe driving behaviors, that helps in the discussion. But they really do need to know that they're at risk because of their illness. It's not them. You know, they say, I've always been a good driver, and everyone says that, but now they have an illness that's making it a problem. I put it in those terms. Okay.
Good morning, my name is Carol Dupay, and I work at St. Jude Medical Center. I don't think it's a surprise to anyone that it's a life-changing event when an individual begins to stop driving. My curiosity is, so we know that one of the things that that happens when people stop driving, or oftentimes when people stop driving, is that depression and anxiety go up. Isolation can occur. There are all kinds of other problems that can also exist because they're no longer as mobile. I'm wondering whether or not there is any change in their Alzheimer's disease as a result of some of the negative factors that occur when someone is no longer as mobile.
I mean, like in terms of like cognitive function
Right,
changing,
right,
we haven't
yeah.
seen that. But certainly the mood changes and the anxiety and the complaints about social isolation are huge. And you have to readdress those matters on follow-up visits. It's a tough issue. You know. Eventually, they get used to the idea they're not driving. I think it usually takes about 6 months.
It takes 6 months. Sometimes it takes a lot longer.
Could take longer, yep. Yeah.
What are the statistics that you have on the numbers of drivers who have actually gotten lost and as a result of that had health risks?
Yeah, so I kind of minimize the importance of memory problems and getting lost in navigational issues, but that is an important problem. It's not that common. I mean, the Alzheimer's Association has a safe return program, which is helpful in that regard, but people do go out for long drives. I've had somebody left Florida to get some groceries and end up in the middle of Georgia. They'll get on the road and just keep going. And I had one person at one of the worst sections of New Bedford in the middle of the night for no good reason, so it can be particularly hazardous or going out driving in inclement conditions.
All right, thank you.
Okay, thank you.